The need for improved surveillance and management of malaria cases in Guyana prompted health authorities to collaborate with Harvard T.H. Chan School of Public Health in the United States of America to host a one-week molecular surveillance workshop where 50 local healthcare providers will be taught advanced sequencing techniques, as well as how to understand and analyze malaria trends. At the launch of the workshop on Monday, Minister of Health Dr. Frank Anthony outlined that the project will, among other things, create a need for a mosquito and molecular surveillance system and aid healthcare providers in monitoring the spread of malaria and drug resistance. He estimated that by the end of the week, the National Reference Laboratory would be capable of conducting genomic sequencing on malaria parasites. Genomic sequencing is a laboratory method that is used to determine the entire genetic makeup of a specific organism or cell type. This procedure is also done to identify variants of COVID-19.
By the end of this week, we intend to make some history here, and that is to be able to do the first set of sequencing right here in Guyana. And I think that would be a big accomplishment for not just this project, but for us as a country.
Director of the malaria program, Horace Cox, told Nightly News that because of the limited availability of malaria medications globally, there's a looming threat of resistance to the drugs. He said locally his department has not been able to ascertain the number of drug-resistant cases in the country, but there is data to suggest that there may be instances.
So currently we don't have a full-blown resistance established in persons, but we found that in the lab setting, the parasite shows resistance. So what we're afraid of is that in time to come, if we don't take the necessary precautionary steps, this will become full-blown, and that'll be a real issue. So to manage that situation, what we're doing is what we call surveillance. So surveillance basically means to continue to look out for something.
He said approximately 18,000 persons become infected with malaria in Guyana each year. Malaria is a serious and sometimes fatal disease caused by a parasite that commonly infects a certain type of mosquito, which feeds on humans. People who get malaria are typically very sick with high fevers, shaking chills, and flu-like illness. Temika Rodney reporting for the HGP Nightly News.